Here we're looking at the axial T2 weighted sequence of an MRI image. We're looking at the T2 weighted sequence because it's good looking at the brain anatomy. It helps designate the soft tissue better from the surrounding CSF fluid. We're going to look at these images inferiorly to superiorly. So to orientate you, the patient is lying down on their back, his or her back, where the feet is towards you and the head is towards the screen. This is anterior, posterior, right, left. At this particular slide, we are at the very upper aspect of the spinal cord. The structure here is the spinal cord, where the spinal cord has not gotten to the brainstem yet. This structure here is the vertebral body of the C-spine, most likely either C1 or C2. Now we're going to scroll superiorly. At this image, I'm going to outline the cerebellum for you. This is the cerebellum. This is the right cerebellar hemisphere, the left cerebellar hemisphere, vermis. Next, I'm going to outline the medulla oblongata. This is the medulla oblongata. Then we have these bright fluid here, which is a CSF fluid. CSF fluid at the very bottom of the fourth ventricle. And from the very bottom of the fourth ventricle, you see some CSF fluid signal on either side. This represents the lateral aperture, or sometimes known as the foramen of Luschka. The lateral aperture is best seen in the axial image, where the median aperture is best seen on the sagittal image. Now we're going to continue on moving superiorly. This particular slide, I'm going to orientate you each structure from anterior aspect to the posterior aspect. Starting here, we have the globe. It's the right globe, and the globe is divided into the anterior and posterior compartment, where this aspect here, this is the lens, and the posterior aspect is the retina. Then we have the optic nerve, the right optic nerve. Then we have the medial rectus muscle, the right medial rectus muscle, the right lateral rectus muscle, the globe, the lens, the optic nerve, the left medial rectus muscle, the left lateral rectus muscle. Next, we have these three dots. These black dots represent vessels. Starting here, we have the right internal carotid artery, the left internal carotid artery, and the basilar artery. Little reminder that the internal carotid arteries supply the frontal, the parietal, and the temporal lobe of the brain, and the orbital structure. The basilar artery forms from the vertebral artery. Next, we have the structure here that's extending out is the internal auditory canal, which houses the 7th and 8th nerve. Then we have the semicircular canal, right here, semicircular canal. This is the left. This is the right semicircular canal. And we have the cochlea, the right cochlea, the left cochlea. This here is at the very bottom of the pons CSF fluid. So this is the fourth ventricle. You can still see the the outline of the cerebellum. I'm going to move to the next slide.